You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Angela, how are you?
Fine. Thank you, sir, for inviting me to this.
Thanks for coming over. It's an interesting domain you're in, right? Can you give us a little bit of kind of background and story of your journey?
Sure, I'll be very happy to. In high school, I decided I wanted to be involved in a little bit of everything, but my intrigue was in pathology, which is the study of disease. And I told my guidance counselor in high school I was going to go on to a bachelor's in biology and go on to become a pathologist, a doctor's doctor. And she cautioned me to not go to general science. She said, get a degree with a career in healthcare that'll still be a foundation for many other careers within the laboratory and beyond the laboratory. And back then it was called clinical laboratory science. And I pursued that at St. John's University in Queens, New York. It is now known as medical laboratory science across the country. But I never regretted the journey I took. I decided to stay as a medical laboratory professional in the laboratory. I was hired as a bench tech at a Long Island hospital known back then as Winthrop University Hospital. I went from being a bench tech to a clinical instructor. I was promoted to a lead tech, then a supervisor, and then a manager. And I eventually became their associate administrative director. And I oversaw anatomic, which is the division of pathology for body parts, as well as the clinical, which is the division for body fluids. And I thoroughly had a passion for my profession. It's unfortunately behind the scenes, but is a major 70 to 80% of diagnostic testing depends on the laboratory for accuracy and precision. And I also consulted for physician office labs, and I was also an adjunct professor for many of the medical laboratory programs on Long Island. I took an early retirement in 2020 after the pandemic, and I thought I'd be retired, but instead I've been very active working per diem at Nassau University Medical Center on Long Island as their LIS project manager. I'm also involved in podcasts, and I've been involved in conferences, Zoom conferences, and in-person conferences. I'm very involved with the professional societies, and I'm still a clinical advisor to many of the local colleges and universities on Long Island for medical laboratory science. And I'm involved on social media because, doctor, if you see all that negativity, I try to renege it with positive, constructive feedback and make a positive outcome and change. So I love my laboratory advocating, which takes up most of my time. And I'm also serving on the New York State Education Board for Clinical Laboratory Science, where the medical lab professionals are a licensed profession in New York State, which we're very proud of. Other than that, I guess a little bit of everything.
Yeah, absolutely. Many people don't realize that, we talk about healthcare and medical professionals mainly as clinicians, like in a direct contact with patient care, right? So, but like you said, what we don't see is your work. And I think it's a very, very important work that you guys are doing. And without it, we wouldn't be the clinicians we are right now, because we, base our decision-making process on what results we get from your side. But patients don't see that, right? So how do you reconcile that with your professional life? Because it's some sort of a like isolating environment, right?
Yes.
You work in, and it's not always pleasant, I would say, or you don't get the spotlight that you deserve all the time.
No, thank you for saying that. I recently wrote an article with a Dr. Ronnie Rhodes from Texas, and we wrote an article that's been doing very well about the workforce in the shadow of healthcare and how medical laboratory science is, as with all the healthcare professions, suffering severe shortages of qualified personnel. But for the medical laboratory, it's even more severe than the nurses and doctors who are in the forefront. We're behind the scenes. So the pandemic alone exacerbated for everybody. But we have a lack of medical media attention, a lack of public awareness, a lack of industry respect many times, a lack of legislative support. And we have many times a lack of compensation that's commensurate with your education and experience. We have technicians that are 2-year degree from colleges, and then they're board certified. And then we have the 4-year medical laboratory, now they're called scientists, and they're the ones who have the 4-year board certification. So we have a lack of the right to practice profession in every state, which I think is also a major issue. Licensure safeguards the profession, the professional, and most importantly, the patient. If somebody does harm to a patient as a nurse or a doctor, you could lose your license, or a pharmacist, or in radiology. But in medical laboratory, only 10 states still have the right to practice the profession licensure. But as I've said before, we had a great collaboration in New York State. Over 21 organizations and unions came together, and we were able to achieve that status. But it's because we're behind the scenes. So yes, there's a lack of appreciation a lot of times, a lack of respect, and it becomes a burnout situation for a lot of the medical laboratory professionals. And yet, as we've said, it's so critical for patient care to have an accurate, precise laboratory value. And sometimes, people think, well, you're in an instrumentation world, so everything is push buttons. And I tell them it's no different than you think the pharmacist only counts pills. There is so much more going on behind the scenes with quality control and quality assurance that you don't realize. In 1995, the National Labor Relations Board finally deemed medical laboratory professionals as professionals, and they said because you have cognitive expertise and you have independent judgment, despite automation is only a tool to assist us.
Yeah, absolutely. And I remember in medical school having the pathology textbooks, and you open them up and you think, how in the world am I going to learn this stuff for my exams? Because it seemed to me at that time that it's
So intense.
completely overwhelming. All kinds of slides and pictures and, differential diagnosis and, all types of like small, cells, different types of ways of diagnosing masses and sectional biopsies and all this stuff. The life depends on you. The life of the patient depends on you, because if you make the wrong diagnosis based on whatever specimen you receive, the clinician doesn't know. The clinician gets the result on a piece of paper and says, "Oh, what I don't. You don't have anything." It's just it's a very important, but in the same time, it's a very unknown job that people need to be aware of.
Thank you for that. And we try to that's what the advocating is all about. We are trying to attract, recruit, and retain, and not just a body. There are a lot of areas where they think pulling people off the street, try to show them what to do and teach them. But you need that education. You need that clinical internship. You need that board certification to warrant your personnel entry standards. And we're trying to attract, recruit, and retain qualified, board certified medical laboratory technicians and scientists. And we need to get much more media support, much more public awareness. We need mentoring at the high schools and the STEM programs to bring them into the colleges. We need at the colleges for the education programs to support medical laboratory science. There are programs that unfortunately have closed. Fortunately, there are programs that have opened. There's a lot of online programs available now. There's also very strategic affiliations that ARUB, Mayo, WDL are having affiliations with a sort of on-the-job training, but with a medical college education. So they're bringing them into the career, hands-on, but giving them the education they need. And I love that about licensure too. It gives you a year to get any education you might need, an internship you might need, and pass that board certification to become a medical lab professional. But when you see television shows and movies and you see news reports, you don't hear about the medical lab professionals in the background. And we need those to come more to the forefront.
Absolutely. And that's that's why I'm happy you're a guest now, because I think it's an important way to make people aware of what you guys are doing. And it's an essential part of diagnosis, patient care, follow-up, subsequent visits of the patient and all this stuff. It's not just like, getting a CBC result. It's a much more complex job and knowledge involved.
They do have now today the PhD program for the medical lab science is known as DCLS.
Mm-hmm.
And these are now PhD medical lab professionals that are graduating and getting hired into these data management programs where they are assisting the clinician in the proper appropriate test to order, and then assisting the clinicians on the interpretation of those test results. And it's a fantastic collaboration, because with nurses and doctors and the medical lab working together, the one that benefits is the patient.
Yeah. So what is the present system right now for your profession? They're mainly hired, they're hospital employees mostly?
No, most of the employees are in the hospital world, many in reference laboratories now, because reference laboratories have taken over a lot of the laboratory testing, the corporations across the country. They graduate from a 2-year technician program or a 4-year medical laboratory science program. And then In states that are licensed, you're mandated, you must pass your board certification, which is a national exam by ASCP. There's also an AMT board certification. But in states that are not licensed, they're not mandated. It's up to the facility to make the requirement. And that's what makes us a little nervous, because you want to have entry-level personnel standards, and you want to have protection and safeguard to the patient that they have the best individuals performing the laboratory testing. And if something is wrong, then they could lose their license in performing that work. Clear is the federal government right now regulates most of the states, and their entry level recently, thankfully, did improve with revisions. They determined that a general science and medical lab science degree is different than a nursing degree. And the nurses, most of the organizations backed us on saying nurses do not want to be doing laboratory testing. They have enough on their plate. They want to have qualified medical lab professionals performing the laboratory testing.
Yeah.
Our biggest issue in the laboratory is pre-analytical errors. How the specimen was drawn, what tubes we used, the order of draw. A lot of times, unfortunately, a resident or a nurse is not aware, or a PA, the proper drawing of a specimen to acquire the proper specimen for testing. And then the laboratory has to call and report it's hemolyzed, it's QNS,
Yes.
we have an error.
I remember my first years of internship in residency was full of like mainly drawing labs on patients by myself, because we were overwhelmed with those cases, and whatever the medical lab workers we had were not enough. So we had to do it ourselves. But again, like you said, we don't know what tubes do we get, how long do they need to be kept in ice or not, or all these details.
There's a certain order of drawers, so there's no cross contamination. And unfortunately, my colleagues that are nurses, my own sister who's a doctor, said I never learned all this. And that's critical to know. So I think there needs to be more collaboration, more orientation of the doctors and nurses with the lab. And when I hear frustration from the lab side, I said, try to put yourself into the shoes of that resident, of that nurse, and they're dealing directly with the patient, and understand as professionals where we're coming from, because we're all here for the same purpose, for quality care to the patient.
What do you think is going to happen with AI?
AI is very interesting. I know because I'm a medical advisor to some of the schools, they're bringing it into the education a little bit. And I know they're out there now in healthcare. And I have maybe sort of a wait and see. I have mixed feelings. I see right now as I'm writing articles and I go searching and AI takes over your Google search and tells you. But then I see it tells you the sources it reached it from. And I go out to those sources to confirm. And sometimes AI is dead right on, and sometimes it's totally wrong. So you have to be checking the sources.
Right. But I mean, I would say mostly in the interpretation of results in the lab world. Like, for example, when you get a specimen from, let's say a lymph node or a mass of a patient in pathology, how can AI take over that kind of interpretation? Because you obviously can, you can have a database of like slides and looks of that sectional biopsy of the specimen, but the interpretation part of it and the knowledge part of it needs to be done by the pathologist.
I agree.
How do you
I see.
Yeah, how do you match those AI performing skills with the human knowledge?
That's a very good point. The most I've seen in the anatomic world is the digital pathology, which is phenomenal. And the pathologists, in the beginning too, with the computer, that they talk to the computer for their diagnosis. It was a little, learning curve, but they got there. And the digital, they very much love it. They can collaborate with other pathologists. But I agree with you. I think AI should only be a tool to assist, but not make the final diagnosis in any way, shape, or form. I think you need that pathologist who, as I said in the beginning, to me is a doctor's doctor, looking at that and determining exactly what the diagnosis will be, and still signing off final from the pathologist.
Yeah. What is the future of your profession? What do you think is going to go?
It's very challenging, but I'm hoping it's going to continue to improve and go forward. But again, every step of the way, it's a difficult time. As I said, we're trying to attract more of high schools, middle schools, and the colleges into medical lab science, but then we need the colleges themselves to support the programs that are mostly NACLS accredited programs. But we also need more attention from the media and more awareness by the public, so that once we attract into the profession, we retain and we recruit them and retain them. And I tell the hospitals and reference laboratories, you have to take care of your staff who are going to be taking care of your patients. And the young generation today are not as eager. I stayed over 40 years at the hospital that I went to before I retired. and you see more turnover rates today in all the careers. And I keep on warning the administrators, you have to make an environment where there's a work-life balance that they want, but hopefully instill in them a passion for their profession so they want to be doing the work and want
Yeah.
to stay in this field, because turnover is not good enough. We're working with government too. We've been doing a lot of lobbying with the professional societies, and I wish more medical lab professionals would join professional societies because they do the networking, collaborating, they do the lobbying, and we're trying to get bills passed to prevent cuts to the laboratory. And anytime there's a bill in Congress, whether it's state or federal, that includes healthcare, a lot of times it doesn't include the laboratory. So we're constantly out there saying, remember when you talk about workforce shortages, to include the laboratory. When you talk about grants and scholarships, include the laboratory. When you talk about a review of salaries, include the laboratory. So I am always the positive, hopeful one. I know the challenges are out there, but I think the options and opportunities are also out there. But we need more to advocate, more of us. I always
Yeah,
say
and
one
you need
person.
more people like you to advocate,
Thank you.
because people don't think about this. They want to
No,
practice, they want to get in and out the job, make a little bit of more money, go home, have a good life work balance, but they don't think about future.
true,
So you
doctor.
need people like you that kind of look at the bigger perspective of the profession, and lobby the state legislature, and all this big personalities that can make a difference for you guys. Um, Let me go back to yourself a little bit. Angela, what do you think is the most thing that didn't work in your profession? And you learn from it, you buckled up, and you move forward.
I would honestly say when I moved up the ladder, I stayed at the same hospital where I was at. And a lot of people told me it's better to leave and come back, but I stayed there. When they see you as a young blood coming out of college and then suddenly you're their administrator, it was hard with some of the older senior established individuals. And then sometimes even the younger ones who were your friends and now and colleagues, and you're now their boss. Well, what I learned, and I learned from some of the best mentors, is not to be a boss, to be a leader. And to be the kind of person that even if you didn't have the title, you're the kind of person they would want to follow. And I just constantly learned to adapt, but also learn to focus on what is right and how to get there, but listen to my staff and my colleagues of what their needs were so that I could incorporate that and bring them on board. So a lot of times when decisions had to be made, I said, well, what's your opinion? And how would you resolve this? And then I would come up with, well, this is how we decided to resolve it. I think it's going to work. Can we give it a little time? And if not, maybe we'll follow your path. And I found that most of the individuals gave up fighting me and became more teamwork. And that's what's so important. I'd say leadership needs to be supported, but in turn supported, but you need to create a resourceful environment of teamwork, of qualified staff that work together and enjoy working together.
I like
And I've
that.
been
Don't be a
fortunate to
boss, be
find
a
that.
leader.
Yes.
Yeah, that's so good. Um, well, leadership is something that you learn also. Um, what are some of the things that you do every day to be a good leader, to be a successful leader? Is there anything, routines, habits, things that you do for yourself first that you kind of manifest for others around you?
That's a good point because everyone says you need to take care of yourself first, otherwise you can't take care of everyone else. And there were times where I came to the point I was getting burnt out because I was doing so much, and you have to take a step back and take a little breather. And then you have to start learning how to prioritize. And something that was very difficult for me was to learn how to delegate some of the work. So again, you talk about the teamwork, and I said leadership needs to have a teamwork, but then you have to be part of that team. So I learned, to take care of myself first and foremost, that I can be there for my staff. But I also am told by my staff that I would always, no matter how difficult things were, still had a smile on my face and still had a pleasant attitude and said, okay, things look really bad now, but let's see how we can organize it to get it better. And we went through some major, the worst for the laboratories when the computers go down and then there's no orders coming through from the floors and results going back to the floors. And I found a downtime procedure where I incorporated the nurses with me from the floors to say, how best can we coordinate this, that you can get the orders to us and we can get the results back to you. And I brought in the supervisors from the laboratory. And that was one of the most successful downtimes we ever had, because my joke too was in the email that went out, don't call the lab. You're going to put downtime for us. Don't call us, we'll call you. And that turned out to be such a successful collaboration of the medical professionals in the hospital working together. So that I was always very proud of, how we
That's awesome.
coordinate a downtime procedure.
Very nice. Very nice. I like that. Um, sometimes it takes a person like that to kind of, tap people on the shoulder and say, hey, slow down, do what's right, with a smile on your face.
We tried.
If you would look back now when you started with what you know right now, what type of advice would you give to yourself retrospectively?
Good point. I probably would tell myself, as I do now, tell my staff and my students, don't ever get discouraged by others. Don't let anyone ever discourage you from your passion. Because there were times when I got very upset and thought I was getting very disillusioned, but I had to catch myself and say, but what am I trying to do? And what is my goal and my aim? So that would be my advice back to myself, to not get so discouraged the way I did sometimes, or disillusioned the way I did. Don't let anyone or anything discourage you. You have that passion for your profession. Don't lose it. Just feed it.
Very nice. I like that. Angela, thank you so much for being here. How can people reach out to you for advice and maybe mentorship to kind of continue what you're doing?
They can find me on LinkedIn, and definitely reach out and message me. I have many individuals that have, and even if I cannot help them, I can find individuals that can through the professional societies or through social media, and I've done so, and I'm very happy to. I am not incorporated. I am a laboratory advocate that is mentoring and mediating and helping with no fee and charge involved. I do this out of the passion for my profession, as I said, so they can definitely reach out to me, and I can always then give them my email, and some of them have my text messaging, so we collaborate across the country. I've been doing that with many different individuals.
Very interesting. I would certainly, encourage people to keep in mind that this type of job and profession is something that we need to at least be aware of, if not doing more about it. And I would definitely encourage everyone to kind of reach out to you and see how they can help in that field. Maybe, someone is in this specialty and want to do more in their own state. I think you're a good resource of information and mentorship. Thank you so much.
Thank you for having me. I appreciate it.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.